Hi, my name is Clarice Lightning, and I'm a CARDS member. I've been a part of CARDS for roughly 5 years now. With the CARD groups that we have such a broad range of people on the teams. We provide feedback to researchers that help improve all steps of their research process. So that can go from creating materials and collecting data, how they go about collecting data, how they go about promoting their research. There might be things that might come across confusing that researchers may not realize, but since we can relate to some things that are being brought to us, we're able to offer those advice. And with the feedback that we give them, they go ahead and make improvements to their research study.
I hadn't been familiar with CARDS until somewhere 2 to 3 years ago when we were working to recruit for a study, and it became fairly clear that we weren't sort of getting a fully representative population like we wanted, and my attention was drawn to CARDS and all they can do and on how many levels they can be helpful to process around research. And so going forward from there, I really made a point of engaging with them early, because that can help inform so many things as you're planning a research project in terms of the importance of the issue at hand that you're researching and the ways in which it's important to diverse sorts of people, how to design the study so that it can be more appealing to wider groups of people, helped us develop recruitment materials so that they were appealing and understandable, and a variety of issues like that that just made it sort of more appealing to people and ultimately more useful to the people that the research is ultimately going to affect. CARDS, the group themselves, is a diverse community of individuals, frequently underrepresented in research. They had received also some guidance from CARDS staff around the issues that we were looking to explore. And I was really impressed by how collaborative the group was. They'd clearly been doing this a long time. They clearly had rapport with one another, and I think that really enriched the sort of discussion and the feedback that we were able to get from them. They also did a very good job getting me engaged in the process. They made it very straightforward. A meeting was set up with a patient advisory panel, and leading up to that, CARDS staff got us together to talk about our goals for the research. They already had a lot of experience in how the group could potentially be helpful. So they gave us a lot of guidance around some issues to think about bringing to the patient advisory group that was really helpful in getting the most out of it. Their expertise and that community engagement really made it even more worthwhile than it would have been otherwise. And then they helped generate, a report for us and feedback around, how the meeting went and how we could integrate that into our project going forward. And it was really, really helpful. Of additional importance to researchers, our Department of Family Medicine and Community Health is the only department on campus that contributes to CARDS, allowing us access free of charge. So that's really a valuable resource that I'd encourage folks to take advantage of.